Good evening. It is, first of all, thank you, Jan Michelle. That was a lovely introduction. I obviously want to thank the University of Cincinnati and all of the sponsors for this event. It is not my first time here in the city, but it is my first time at this Freedom Center, which is absolutely fabulous. So I really appreciate the opportunity to be here with you, but also to see such a lovely place. Vice Mayor Crowley said that the city is ready, and in many ways this event could serve as that kind of renewed commitment. I know there are commitment cards that you've been given. I encourage you to really think about the kind of collective action that will make a difference in the city. I do have some thoughts to share, and I'm really pleased to be here, and I look forward to hearing from the panel and other comments. I must say that the video really starts us in the right place by focusing in on survivors. And we've worked with the National Survivors of Violence Prevention for 10 years now, and I get such a tremendous energy from that work. It is inspiring to see people take pain at a level that most of us can't imagine and turn it into power and action. So I want to applaud those survivors who are here tonight, as well as those who shared their story on the video, because of what you do, not only for me, but really for all of us in keeping us inspired to do this work. So join me in just thanking the survivors. Boston is one of those cities that experienced a decline in youth violence, actually a rather remarkable decline in the mid-90s to late 90s. We are among cities like Cincinnati now. There are about 25 or so in the country recording an increase in violence. So we had a success. Many celebrated that success. President Clinton and Janet Reno came to Boston to celebrate. And victory has many, many handmaidens. It does, actually. Many step up to the plate because many are actually involved in creating a victory. And if there's any message from the Boston experience that I can share with you, it's in this slide. There was no one program or one model that contributed to the success. It was a collective set of programs and activities, and we had that collection over time. In many ways, what you see here in the red bar, or the red line, is the number of children who were murdered in Boston with a gun who were 16 or younger. This is the actual number, not the rate, the actual number. And you'll notice in the late 80s, we were at about 1 a month. Now that number did decline to 0 in the mid-90s, and it remained at 0 for almost 4 years. In 2000, early 2000, the numbers started creeping up, and we are trying to rejuvenate and renew our efforts now in the city of Boston. But I show this to you to share one of the fundamental aspects of calling violence a public health problem. And that is that it means it is a preventable problem. A theme of my conversation with you this evening is that violence is preventable, and one of the ways I know that is on this slide, the success that we did have in Boston. It's been about 25 years or so that people in public health have been calling violence a public health problem and claiming it, using epidemiology to understand it, using our advocacy, policy, regulations, and outreach education strategies to prevent and intervene. We've learned quite a bit, and it's worth sort of setting the stage here by just saying there are at least these 4 reasons why we call it a public health problem. One has to do with the magnitude of the problem, the toll that it takes on life and limb, and we don't have to spend much time on that. A second has to do with the characteristics of the problem. And interestingly, many are surprised to learn that family and acquaintance and friend violence accounts for a significant part of the violence. 30% of the homicides in the United States occurs in the context of family members. Another 20% or so among people who know each other. With rape, with assault, we're looking at numbers among friends and family and acquaintances and people who know each other that are striking. And many are surprised to hear that, because what often makes the 6 o'clock news is that stranger bad guy violence. It's very interesting because in the United States, interracial violence, a black person killing a white person or a white person killing a black person, makes national news, and often for 3 and 4 days. 90% of the people who are killed in the United States, black or white or Latino, are killed by someone of the same ethnic group. So in many ways, our news sets one kind of picture in our mind, and often our public policy follows that picture. But when you look at the data, you get the strong impression that there is another part to the problem. The contact that health professionals have with victims and perpetrators was yet another reason we stepped up to the plate. It was in the emergency room, Jan Michelle, that a young man told me after I was stitching him up, don't go to bed, because I'm going to go home, I'm going to get the guy who cut me, I'm cutting that guy, he's going to be in this emergency room, you're going to get all the practice you need putting in stitches. And he said it with a kind of humor and, you know, bravado, and I had no prevention protocol. With him laughing, we laughed, and he laughed, and almost immediately, this was 1978 in Boston, just before the blizzard of '78. And interestingly, immediately I started feeling inadequate, knowing that if he had made a suicide attempt and said, don't go to bed, I'm gonna go home, I'm gonna take some more pills, I'll be back in this emergency room in about an hour, we would have responded very differently. And in fact, we wouldn't have waited on him to volunteer that information. We had a protocol to ask the questions. So it struck me almost immediately that we were stitching people up and sending them out. We had this contact with victims and perpetrators, but we had no prevention protocols. Lastly, we felt like some of the same strategies that we use to prevent smoking or get people to wear seat belts or prevent drunk driving, that those strategies might help with this problem of violence. And in fact, we have learned, and I'll share some of our learnings over the 25 years, that it is in fact a public health problem. It is in fact a preventable problem.